Good morning. This is Dr. Timothy Scott Beck. Today is March the 6th of 2023, and I want to thank you first for listening to me, and I hope you're having a good Monday. So I want to go ahead and get started. First of all, I want to give you some clinical information. A few weeks ago, I talked to you about the nasal flushing rinses, and lo and behold, this week there was a report on the news where it was showing that somebody had contracted a rare infection because they used tap water to use the sinus rinses. Okay, and I just want to point out to you, do not use tap water for these sinus rinses. Okay, you've got to boil the water, or you've got to use sterile water, or distilled water even. Okay, but you do not want to use pure tap water. There's organisms in the tap water that our bodies easily handle in our stomach that are there all the time. You really can't get rid of them for the most part unless you boil it. And there's no problem. But if you put these in other places, those things can turn into real problems and can hurt you. So again, boil the water or use sterile water when you're using the saline rinses. They work great, and it's definitely the season to get started as soon as the pollen comes out. But just make sure you use them safely, okay? The next thing I'll talk about, back pain. We talk about back pain a lot here because we see a lot of back pain. And I want to just talk to you a little bit about how we treat back pain. So back pain, low back pain is typically related to irritated nerves and subsequent muscle spasms. And that's where people get really hurting when it comes to their back pain. And that's what drives people to see me, is that pain related to the spasm of the muscles around that area, and it hurts. It's a terrible pain. A lot of times it'll radiate down your legs if it's a specific nerve that's irritated, and that's called referred pain. So a lot of times when people come in and say, "Hey, my foot's hurting," and they show me where the foot's hurting, and then I can actually have a map where I can map out the nerve distributions in that area and say, okay, this is where it's coming from. It's actually coming from your back. But some of the things we do for that, first of all, you can do conservative therapy, which like massage therapy works, chiropractic therapy works if you're not too bad. And actually you can do a pretty good maintenance program with like a massage therapist where you get a massage every month or so on your back, and that will help mediate your pain. We also treat it with anti-inflammatories or non-steroidal anti-inflammatories, which is like prednisone or meloxicam or Aleve, or those things right there. But those have limited help with that. The next things we can do are physical therapy. And actually, we're blessed with a great physical therapist in this community. There's a couple of them that really do good with back pain, and that's what I always recommend you do with your back pain. Sometimes, though, the physical therapy and all the things don't work. We may give an injection. And so we'll give an injection back, and I'll try to get it on that nerve, and that will actually help settle things down so you're not in so much pain. But sometimes that doesn't work. Then after that doesn't work and we've wore out physical therapy, then we start looking at imaging. And we might do a regular back x-ray, which a lot of times is not going to show us a lot. But the best imaging you can do is an MRI. And that'll tell us exactly if your pain is correlating with what we already think is going on. And that's the reason we do the MRIs. Typically, though, when we're doing an MRI, we're looking for a surgical lesion that has to be fixed. In other words, we've exhausted all of our easy stuff, and now we're looking for more difficult stuff to manage. And that's why we do an MRI. And if you have an MRI and you have specific lesions or things that we can really see on there, then that's when we refer you to neurosurgery so that they can look at it and give us their opinion on whether you will require surgery or not. A lot of times we don't send people to neurosurgery till we make absolutely sure they have a surgical lesion. And then the surgeons, they will give their opinion on whether it's a surgical lesion or not. Of course, I got to listen to them because they're going to be the ones doing the surgery. But a lot of times they agree with what's going on because of the way I set it up. I do a lot of the homework before they get there. So that's how we deal with back pain. Back pain can be, you can cause back pain. I mean, there's people out there that go do things to make their back hurt, like moving or moving heavy stuff. But you don't have to do that to get back pain. The best way, I mean, you can get it just spontaneously. I've even had back pain kick in with me when I was shaving, out of all things. But I do know that whole body exercise where you are strengthening your core muscles and watching those throughout the years definitely helps with back pain, and staying physically fit and again staying symmetric helps a lot to mediate your back pain as you get older. So that's a lot on back pain. If you got back pain, we want to hear from you, and we'll help figure all this out and do the best we can for you, I promise. Some other things, we got our weight loss shots that are doing great. Okay, so we've had several people, we've had probably 30 people sign up for it now, and preliminary results are really good with that, and it seems to be safe and not having many adverse actions, which is wonderful. And then remind you that we've got the RPM and the remote patient monitoring and the chronic care management programs, which we are promoting here in the office as part of Medicare's plight for us to take care of this community. And we're doing really good, and I appreciate everybody's cooperation. And it's helped us already to really help people out, so I appreciate your cooperation with that. Well, listen, it's Monday morning, and I've got to get to work. I appreciate you listening to me. Certainly, we want to hear from you if you're having any issues that we need to address with you. Have a great day.